While the numbers of new cases and patients in hospitals is rising, so far our deaths of COVID-19 have stayed relatively low.
Tonight, CBS 17 digital reporter Jody McCrary is digging deeper and fact-checking a statement from Senate leader Phil Berger about just how low they've been this month.
It's true, COVID deaths are down from where they were in the winter, but one claim from Berger may have gone too far. A release from his office says there were fewer COVID deaths during the entire month of July than a given day in January. That technically may have been true yesterday, but it isn't anymore. Today's numbers from DHHS show 129 people have died of COVID so far this month. There weren't any single days in January with more deaths than that. That total likely to go even higher. There can be a lag of 2 weeks between when a death happens and when it's reported. So we might not know exactly how many people died this month until the middle of August.
So we may see those numbers increase significantly over the next few days, next weeks.
I asked Berger spokesman Pat Ryan why they framed the numbers that way. He says we should be relieved that vaccines have prevented more deaths and that focusing on the bad news causes panic. Deaths as a whole are way down from where they were 6 months ago, from an average of 97 a day in January to 5 per day in June.
Definitely the decrease in deaths since January is most likely due, in fact, almost certainly due to the rise in vaccinations.
But will they stay low? Our hospital numbers now could give us a clue. In just 2 weeks, up 120%. Experts say virtually every COVID patient in a hospital is not fully vaccinated, making them more susceptible to dying.
People who are dying right now are the people who have not been vaccinated at all.
So when could those numbers climb again? I went through the projections, and in my story online, I explained why deaths could rise in the next weeks or months. For CBS 17 News, I'm Jody McCrary.